Dr. Ramon, if we are fully vaccinated, how worried should we be about the risk of a breakthrough infection, quote unquote? It's only anecdotal, I know, but there do seem to be more and more stories and examples of breakthrough cases doing the rounds right now.
Well, you're asking the right question, and this is the question that we really need to be answering right now with good data. And that's been one of the problems here, is that we don't have these data available. What we know, though, which is really important, is that these vaccines are doing a really good job of keeping people out of the hospital from severe disease and from dying. And that is really what these vaccines were developed for. What we're talking about here are a difference between a breakthrough infection versus breakthrough disease. Breakthrough infections we anticipate will happen. Breakthrough disease, where people are either symptomatic and highly symptomatic, that's something where we really we need to be tracking much better. Right now, the CDC is only tracking cases that are severe enough where people are hospitalized or if people are dying. What we need to do, we need to get back to the business of really understanding what's out there, where these vaccinated cases, breakthrough cases are coming from, if there's certain people who are more likely to have breakthrough or not, and then we can start making some recommendations based on that.
And just quickly there, before we move on, you think the CDC should be tracking all breakthrough infections, not just hospitalizations and deaths?
I do. It's really important to understand where these breakthrough infections are happening, who it's happening to, are there certain vaccines where it's more likely to see a breakthrough? And then the big question is, can vaccinated people who are having a breakthrough infection be a part of a transmission chain? It's very possible, given this Delta variant provides so much more virus that's circulating, and you have about approximately 1,000 times more viral particles shedding than the original variant, the original strain of this virus. So it's very possible that people are part of transmission chains. We need to understand that, because that has big implications for masking and other other things.
Yes, it does. And a lot of the anti-vaxxers, Dr. Ramon, are pointing to data out of Israel that shows growing proportions of people who are fully vaccinated testing positive for COVID. But that's not evidence of the vaccines not working, is it? What's your response to those anti-vaxxers?
No, actually, this is evidence of the vaccines working, doing exactly what we want them to do, which is, as we've talked about before, we just talked about keeping people from having severe disease, being hospitalized, or dying. Just having a mild infection or an infection that doesn't land you in the hospital or where you end up dying is probably acceptable. As I said, the big question is, can vaccinated people transmit? It's likely that they transmit less than people who are not vaccinated, but we just need the data. But there is by no means any evidence here that an anti-vaxxer should be able to use to say, oh, hey, this is why you should not get vaccinated. This is why you should get vaccinated.
Yes, indeed. You mentioned masking. Let's talk masking. The American Academy of Pediatrics is saying today all kids in school should stay masked, regardless of their vaccination status. LA County, of course, has brought back masking indoors at public locations for all adults because of the spread of the Delta variant. Again, regardless of vaccination status. Is it time the CDC followed suit for the nation as a whole? Was it a mistake? Was it too soon to drop the previous mask guidance back in May?
I mean, of course, hindsight is 20/20, and that's the thing that people have to remember here, is that this is a novel virus. We're still learning about it. We're going to have recommendations change over time. I do think it's time to really reconsider mask guidelines, and I think that these guidelines about masking in schools is very prudent. It makes a lot of sense. First of all, schools cannot be in the position where they're going to have to sort out who's vaccinated and who isn't and have different rules that they're going to have to enforce. The fact is that kids under 12 are not yet eligible for vaccines. They won't be. And so even if we don't see any breakthrough cases, if people are not going to be part of transmission chains being fully vaccinated, we still want to be able to provide the opportunity to protect all of those people under 12 well. But again, because it's very possible that vaccinated people we want to be able to mask.
Yes. Just one last quick question on breakthrough cases. Do we know Are there certain vulnerabilities? Are there certain factors which make someone who is fully vaccinated more likely to be the breakthrough case? Because I know a lot of the cases in the UK, for example, who are the hospitalizations among people who are double jabbed tend to be over 50. Are there other conditions? Is it age? Is it to do with your weight? Is it to do with pre-existing conditions?
Well, that's a very good question, and all of those things make a lot of sense. So what we've seen from the data that's available in terms of hospitalizations, it tends to be people who are older, people who do have underlying conditions, people who in particular who are immunocompromised. All of these people need to be more cautious. That means for people who are falling into these categories, it's a good idea to mask up in addition. So that's another layer of protection. More protection is good, in particular at this moment where we're seeing a rise in cases nationally and globally.
Dr. Anne Rimoin, appreciate all your analysis, your insights. That was a very useful, fascinating conversation. Thank you for joining us tonight.